So next we invite Dr. Manpreet Kaur to present the paper on long-term assessment of PC-IOL optic adherence and anti-YAG capsulotomy rate of surface-modified IOL. This was the AIOS Sante Vision Award of last year, I think.
Yes,
Yeah,
ma'am.
congratulations at first for the award.
So, a very good morning to all of you. I'll be presenting our research on long-term assessment of posterior capsule, IOL optic adherence, and its impact on the NDR capsulotomy rate after implantation of a hydrophobic acrylic IOL with ozone surface modification. There are no financial disclosures. So, various techniques of intraocular lens surface modifications have been described over the years: surface coating, covalent grafting, etc. The main aim has been to enhance the biocompatibility of the material and lead to a significant decrease in the incidence of posterior capsular opacification. So, a new aspheric hydrophobic acrylic IOL with posterior surface modification was introduced a couple of years back with UV ozone treatment modification. The mechanism proposed was that there is an increased adhesion of fibronectin and less epithelial cells to the posterior IOL surface, which promotes IOL adhesion to the posterior lens capsule and prevents PCO. So what we aim to study was the PC and IOL optic adherence in surface modified IOLs and its impact on the NDR capsulotomy rate and visual quality. A prospective interventional study of 93 eyes with IMSC was conducted at Dr. Rajendra Prasad Center for Ophthalmic Sciences, AIMS, New Delhi. All cases were implanted with the hydrophobic acrylic IOL with posterior surface ozone treatment, and cases with any comorbidities were excluded. The primary outcome measure was the posterior capsule adhesion to the IOL optic and ASOCT and the NDR capsulotomy rate. Secondary outcome measures were visual quality assessed using ray trace aberrometry. Follow-up was performed on post-operative day 1 and 2 years. So these are the demographic details. No case had any intraoperative posterior capsular rent or vitreous loss, and at 2 years, 94.6% had a corrected distance visual acuity of 20/20 or better, and 100% had a corrected distance visual acuity of 20/32 or better. So, complete PC to optic adhesion at 2 years was observed in cases that had an initial smooth PC configuration. So, this is the day 1 ASOCT, in which you can see there is 497 microns of fluid between the IOL optic and the posterior capsule. At 1 year, it reduced to 80 microns of fluid, and at 2 years, there was a complete PC and IOL optic adhesion. In cases with a wavy initial PC configuration, there was a persistent PC optic inadhesion at 2 years. So as you can see in this case, even at 2 years, 96 microns of fluid persisted. So 2.9% cases had a complete PC optic adhesion on post-operative day 1. At 1 year, the figure increased to 67.6%, and 2 years, nearly 3/4 of patients had a complete PC optic adhesion. So Zhu et al. Had earlier evaluated PC optic adhesion in visual axis after phaco. They observed 41.5% cases only to have a inadhesion at 1 day and 7.1% at 2 months. However, why did they observe such a low incidence of persistent inadhesion? One, the IOL used, of course, was different, and they used sheen plug imaging, which is much less sensitive than ASOCT in picking up these residual microns of fluid. It may have grossly underestimated the PC optic inadhesion. Except for this, there's no other study that has tackled this topic. Visual quality at 2 years. The residual PC optic distance positively correlated with total higher order aberration. So the more the PC optic inadhesion, the worse the visual quality. So posterior capsular opacification developed in 7.5% cases as 2 years, and no PCO in 92.5%. Of these, 85.7% cases had persistent PC optic non-adhesion. So non-adhesion was a risk factor for PCO development. NDR capsulotomy was needed in 3.2%, and all cases requiring a YAG cap had persistent PC optic non-adhesion. So we conclusively concluded that inadhesion was related to a higher rate of NDR cap. So just to conclude, surface modified IOLs are expected to have higher rates of PC optic adhesion with less PCO. Nearly 2/3 cases at 1 year and 3/4 cases at 2 years have complete PC optic adhesion. Complete PC optic adhesion correlates with a superior visual quality, less PCO, and no NDR laser capsulotomy. This was the first study to characterize the PC optic adhesion using a high definition ASOCT in a surface modified hydrophobic acrylic IOL. Thank you for a patient hearing.
Thank you. It was indeed a wonderful presentation. Thank you.